In this video, we will be talking about the approach to the patient with dysphagia. That how we will approach a patient with dysphagia. Dysphagia means difficulty in swallowing. So whenever a patient presents with dysphagia, the first step is to evaluate that whether the difficulty is with solids only or is there is a difficulty with solid and liquid both. If there is a difficulty with solid only, it means that the patient is having mechanical obstruction. And if there is a difficulty with both solid and liquid, it means that there is some motility problem. By the motility problem, we mean that the esophageal wall is not producing proper coordinated contraction and relaxation. So let's discuss first the difficulty with solid only. As we discussed that whenever there is a difficulty with solid only, the cause is mechanical obstruction. After this, the next step is to evaluate that whether this obstruction to solid is intermittent or progressive. Intermittent means that it occur at regular intervals or it's a progressive. Progressive means that it slowly increases with time. If there is an intermittent dysphagia, it means that there is a lower esophageal ring. This lower esophageal ring is also called as a Shadsky ring. And if there is a progressive dysphagia to solid, then we have to ask for other symptom. It means that if the patient is having a progressive dysphagia to solid, then we have to ask for other clinical symptoms, and those symptoms will guide us to the diagnosis of dysphagia. If the patient is having a progressive dysphagia and along with it the patient is having chronic heartburn and GERD and there is a no weight loss. So progressive dysphagia to solid with chronic heartburn or GERD and no weight loss, the most common cause is peptic stricture. And if there is a progressive dysphagia to solid and the patient age is greater than 50 years and if there is a history of weight loss, then we should think about the esophageal carcinoma. So it is how we will evaluate the patient with dysphagia who is having dysphagia with solids only. Now come toward the dysphagia mean difficulty in swallowing with both solid and liquids. As we discussed, whenever there is a difficulty in swallowing to both solid and liquid, the most common pathology is motility problem. Mean the esophageal wall is not contracting and relaxing properly. So to evaluate this patient, the next step is to check that whether this dysphagia or the difficulty in swallowing to both solid and liquid is intermittent or progressive. If the features are intermittent and the patient is experiencing chest pain, a typical angina like chest pain mean chest pain radiating to back, jaw and arm. The most common diagnosis will be diffuse esophageal spasm. And if the dysphagia is progressive and the patient have a clinical feature of chronic heartburn and GERD, the diagnosis will be scleroderma. And if the patient is having a progressive dysphagia but along with the progressive dysphagia to both solid and liquid, the patient is also experiencing regurgitation and weight loss. So the most likely differential diagnosis will be achalasia. So it was all about the approach to the patient with dysphagia, that how we will reach to the diagnosis if a patient is presented with clinical feature of dysphagia, mean difficulty in solving.